Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Yes, doctor. I am Anna Caroline. I'm 32 years.
Okay, how may I address you?
Please call me Anna.
Okay, Mrs. Anna, today we are going to discuss about your health issues. Will that be all right with you?
Yes, doctor. Okay.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Well, now, Miss Anna, can you please tell me in your own words what brought you here today?
Doctor, about a week ago, I suddenly noticed that my face seems to be abnormal. That I thought I noticed that my face somewhat drooping. Then I came to my GP, and he told me that I have some nerve lesion in my face. So that needs evaluation. Then he started a medication called prednisolone tablet. And with the medication, I felt better in the following days. And after that, he thought that I need further evaluation. So he sent me here. I really don't have any problem right now. I am improving, but I have little weakness now. Otherwise, I don't feel any other problem with that.
Okay, I can get it. I will try my level best to find out what's troubling you. May I know that did this problem come along suddenly or did it come along gradually?
Suddenly.
Okay. And since then, has it been present all the time, or have you felt that it went away or comes again,
No,
or all the
it is
time?
present all the time. On that day, I visited my GP and he gave me prednisolone tablet. And with that tablet, I think that after that, I started improving gradually.
Okay. And how do you feel now? May I know?
Much better.
Much better. Okay. And can you please specify actually what weakness did you feel when this problem started? What actually happened?
That I noticed that I cannot eat properly.
Okay.
There was some problem with closing of my eyes also.
Okay, I can get it. I can get it. And okay. And have you before going to GP, have you tried anything else that made you better, feel better, or
No,
something that made it worse?
no,
Oh, okay. And have you found that there is any time variation of the day when you feel far better now or far
no,
worse
no.
than the other time? Okay, that's good. And I told you that uh, how severe it is now. Can you please describe it for me?
It's improving, doctor, and I feel quite well now.
That's all. That's very good to know. And may I know that do you feel that only one side was affected or both sides?
Both sides.
Okay, did both sides were affected at the same time, or did
Yes,
one side affect first and then
same time.
same time? Okay, that's very that's thanks for the information. Now let me ask you some more questions. That before this occurred, you told that this occurred around 7 days back. Before this problem started, did you had any raised temperature?
No,
Okay. Any chest pain,
no,
racing and pacing of your heart, or shortness
no,
of breath?
no. But I have
Any cough?
usually I have shortness of breath and cough.
Okay. When did may I know that for how long have you been facing this shortness of breath or cough?
About 6 years.
Okay. Uh, Now may I know that did both of these come along at the same time, more or less?
Yes, doctor.
This shortness of breath and cough.
Yes,
Okay. 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 And may I know that is this cough dry or does this produce any phlegm?
it was dry.
It was dry. And how is it now? This problem of cough, is it controlled or is it worse than 6 years?
It is better now.
It's better now. And how frequently do you feel do you experience this cough nowadays?
Initially, I had this problem, and after giving some medication, I felt better. And
Okay.
I stopped the taking medication about 6 months back. After
Yeah,
that, I think this symptoms is increasing again.
I can get it. And is there any specific time of the day or week when you feel that this cough is more?
No,
Okay. Anything that makes it better, this cough, or anything makes it worse?
no,
Okay. And you also told that you have some shortness of breath. how has this progressed, this shortness of breath over the last 6 years? Have been the same, or is it progressing or improving?
It was fine initially, but I told you that I stopped medication about 6 months back, and after that I am feeling worse again.
Okay, and how is your daily work being hampered due to this shortness of breath? How long can you go now? What can you walk now?
I can do
Since
my
the six
own
months,
jobs, doctor, but it is
you
very
can do.
yes, it is very difficult for me to hurrying up or climbing the lift, climbing the stairs.
Yeah, I can get it. I'm very sorry to hear it. Okay, and have you ever felt that you have to use extra pillows at night to be more
Oh,
comfortable? Okay, any swelling in your legs that you have had?
yes, doctor, there were some lumps in my legs
Okay. For how long have you been facing this?
for last 1 month.
For last 1 month. Okay.
Yes,
Is it painful or is it raised? Have you noticed? Is it raised from the skin or is it
yes,
at the same level with the skin?
rest and painful.
Raised and painful. Has it spread to somewhere else, or has it been only in the same one place or same places?
One my legs only,
Both legs or one leg?
both legs.
Both legs. I can get it. Uh, I'm very sorry to hear. And have you seek any medical attention for this
I took
for this
some
problem?
over-the-counter medication, some ibuprofen tablets, and with that my pain was fine. So I didn't seek any other medical attention for that.
Okay, I can get it. And okay, and now may I ask you some other questions? That do you have any headache?
No,
Any difficulties with your vision?
not now.
Okay, previously, did you had any redness in your eyes or any
Yes,
other problems in your vision?
yes, doctor. I had about 3 times redness over the last 6 months.
Okay, and did you seek any medical attention for that?
No, it went on its own.
It may not resolve. Okay, I can get it, and I can get it. And do you have any joint pain?
Yes, doctor.
Which joints may I know?
Joints of my hands and also my knees.
Okay, and for how long have you been facing this?
Uh, that is around for last 3 months.
Okay, and do you feel that there is any morning jamming present or not?
Yes,
Okay, and any for anything that makes it worse or better? This joint pain.
I think working in the morning that makes me somewhat better.
Okay, and any redness or swelling around the joints? Have you noticed?
No,
Okay, any rashes anywhere in your body other than the lumps in your legs?
no,
Okay, and any you told that you have faced this weakness in the face, but may I ask you that do you have you ever experienced any other weakness in any other parts of the body?
no,
Okay, and any abnormal sensation in any parts of your body?
no,
Okay, any difficulties with swallowing?
no,
Okay, and any difficulties with your speech ever
no,
except
no.
now? Okay, and may I know that what about your water work? Is it all right?
I think that I am passing more water than usual.
Okay, have you ever had to get up at night to pass your
Yes,
water work?
doctor. For last 1 month,
How?
it has also become
Okay,
problem about 2 to 3 times a night.
okay, I can get it. I'm very sorry to hear. And yes, have you ever passed out any blood through your water work?
No,
Okay, and how is your bowel habit nowadays?
it's good, doctor.
No problem.
No,
Okay, any blood in your back passage ever?
no.
Okay, that's very good. May I ask you some other questions now? That have you ever been diagnosed with any diseases?
About 6 years ago, I was diagnosed with asthma for my cough and for my shortness of breath. And at the time, they did a X-ray, and they said that there are some scarring in my X-ray. So that they gave me inhalers.
Mm.
One is salbutamol inhaler, and another is fluticasone inhaler. And when the condition get worse, they gave me some prednisone tablets. With that, I was fine.
Okay, and you stopped those around 6 months back.
Yes, doctor.
Am I right?
I was completely well, so I stopped that.
Okay, and any over-the-counter medication except ibuprofen?
No,
Okay, how may I know that how much ibuprofen have you taken? Highest?
Around 2 to 3 tablets a day.
Okay, that's all right. Any any are you allergic to any other medication? Do you know?
No,
Okay, and may I ask you some other questions now? That do you have anybody in the family with similar type of problems?
no,
Okay, and do you have any problem with your? Do you yourself have ever had any problem with your blood pressure or blood sugar level? Do you know
no,
of it?
no.
That's all right. And may I ask you that some more personal questions now at this moment?
Okay, doctor.
Okay, do you smoke?
No,
Okay, do you drink alcohol?
no,
Do you take any recreational medication? I'm very sorry to ask. It's a personal question, but may I know?
no, no, no.
Okay, and now may I ask you some other personal questions as well, if you allow me?
Okay, doctor.
Okay. May I know how about your menses? Is it all right?
Yes, doctor.
Okay, and may I know that are you single or are you living with somebody or no? Or no? Okay.
I am married, doctor.
Okay. May I again ask you some personal questions? That have you ever thought of having a baby or do you have any baby?
Yes, doctor. I have a child of 3 years.
Okay. Do you ever had any history of birth loss, pregnancy loss?
No,
Okay. And do you take any medication for not being pregnant at the time being?
yes, doctor.
Okay, that's all right. May I know you some other ask you some other questions now? That what do you do for your living?
I'm a solicitor, doctor.
Solicitor. Okay. And how is your problem affecting you now for the last 7 days?
Yes, doctor. That made me somewhat distressed at work because after having problem with my face, I had some
Yeah, yeah,
problem in my speech at that time and also faced a little bit
yeah.
problem. But now I'm coping with it.
I
So
can
it's
get
a
it.
medic.
May I ask you that before these symptoms occurred, did you travel to any other country recently?
No,
Okay, that's all right. And may I ask you again a very, very personal question, if you don't mind? It's a very personal question, but it would be better if you ask me, if you reply me. Will it
okay.
be okay? Um, have you ever had any partner other than your husband or
No,
ever in your?
never.
Oh, okay, okay, that's all right. That's all right. I'm very, very sorry to ask you. Okay, and may I know at this moment that what are your concerns are?
Why I have developed this, doctor? And is it
Yes,
something
yes.
serious like cancer?
Yes, I can get it. At this moment, actually, I will have to examine it thoroughly and do some tests. But as long as I have taken history from you, I think that at this moment you have a chance of having a condition named sarcoidosis. Have you ever heard of it?
No.
Okay, please don't bother about it. It's a condition in which body's defense system can actually harm our own body cells rather than harming the bugs. Okay, and it can actually affect many more parts of the body, like your chest, like your nerves. Okay, nerves of the face, and even it can cause the lumps that you are having in the legs and the occasional redness that you are having. Okay. However, at the beginning, we will have to diagnose it properly. Then we will form also a multidisciplinary team and involve the chest doctor, the skin doctor, the eye doctor, okay, and also the nerve doctor, and they will come to a decision. But as long as I have examined taken history, I think that it's highly improbable that you have cancer. Okay, and are you getting me, Mrs.
Yes, sir.
Anna? Yes. Do you at this moment have any more concerns or queries?
Do I need any special arrangement or any emergency treatment? Time off.
Okay.
To examine the patient.
Yes. At this moment, I would like to examine the patient. Uh, First of all, I would like to tell the patient that I will check his face power. Okay, and I will sit in front of him and then tell him to fix his head and just look up towards the wall. Okay,
Okay.
is the frowning okay? Okay, then I
No.
will tell him to please close. Yeah, can you please close your eyes? Don't let me open it. Hold it tightly. I will try to open it. Don't let me open. Okay,
She
how
can
is it?
she can close but cannot hold tightly.
Okay, and now you can open your eyes. Can you please show me your teeth?
Yes.
Okay. Is it deviated or is it the same?
Not deviated.
Not deviated. Okay. And now, now I would like to. Sorry. Now I would like to tell him to make a path. Okay.
Difficult.
Difficult. That's all right. And now I would like to open his mouth. Tell her to open. Can you please open your mouth and make R as a sound nice like R?
Okay.
Okay. And is there any ptosis present?
No.
Okay. And then I would like to do her knee jerk and plantar.
Flexor.
Okay. And then I would have a look at her. I would like to have some gloves and have a look at her lumps. Is it painful or surrounding area? Erythema present or any ulceration present or not?
Scarring present. Some rest area present.
Okay. Okay. And then I would also like to have a look at her eyes. Any redness present now?
No.
Okay. And then I would like to go back to her, tell her to please sit down and examine her back, whether there is any present, any crepes present in the lung, or how about the lung field, the basal regions?
Basal region clear, but in the upper region there are fine crepitation.
Fine crepes. Okay. Okay. That's all right. So I think that's all for the examination part.
Okay.
Yeah.
Would you like to check the pulse?
Yeah, sorry. I would like to complete the examination by checking his pulse and blood pressure, urine dipstick. Okay, for proteinuria and hematuria.
Do you think that our hands should be examined for any rheumatological involvement?
Glands.
Limbs.
Oh, sorry. Hands.
Yes.
Yeah. I'm very very sorry. Hands must have been examined. This can be a cause of vasculitis as well. Okay, so hands must be examined. First of all, I would like to tell her to just rest her hands on the pillow, and then I will tell her that I'm just going to touch the joints. If you just feel any pain, please let me know. Okay? Yeah. Are they painful, the joints?
No.
Okay. Now I would like to tell her to make O and hold that tightly. Don't let me open.
She can do that.
Okay. And just spread out your fingers. I would like to squeeze your fingers. Okay, from inwards. Don't let me do it. Hold it tight.
Oh.
Can she do it?
Yes.
Okay. And now can she just make a fist, and with the back of the hand can she just put pressure on my hand upward?
Yes.
Okay. And can she make a prayer sign and reverse prayer sign?
Yes.
And can she just hold the coin that I have put on her pillow?
Yes.
Okay. And I'm just going to tap your hand a bit. Please tell me if you feel any pain, any features of carpal tunnel syndrome.
No.
Okay. I think that's all for the examination part.
Okay. So, what have you reached any diagnosis?
Well, I think based upon the history I have elicited, I think the most probable diagnosis would be bilateral facial nerve palsy due to sarcoidosis. However, I have some differentials. I think it can also be a case of Lyme disease. It can also be a case of vasculitis and others. And it can also be a case of bilateral stroke, though rarely. And I think these are the main differentials in this patient.
Okay. So how will you like to investigate her?
Okay. First of all, I would like to do some basic blood tests like complete blood count to see whether she has any infection, neutrophilia or not, and any thrombocytosis or not. Okay. And then I would like to do rule out inflammatory condition by checking ESR and CRP. And then I would like to do some tests to confirm her sarcoidosis, like doing serum ACE, angiotensin converting enzyme level, then measuring serum calcium level, doing high resolution CT scan to look for any features of reticuloneural shadowing and hilar lymphadenopathy. And then I would also like to check her urine with microscopic examination to look for any proteinuria or hematuria present or not. And I might also I might also have to do fundoscopy, and for confirmation of the facial nerve palsy, I might have to do nerve conduction study and electromyography as well, I think. I think these are the main tests.
Do you like to go for endobronchial biopsy?
Yes, I should also go for endobronchial biopsy, and I will have to look for CD4 CD8 count ratio, which will be increased in this patient, which should be, and there can also be non-caseating granuloma present.
Do you like to go for the serum ACE level?
Yeah, I told it. Serum ACE level. I told it in the beginning. Serum ACE level, serum calcium level.
And do you like to go for the tuberculin test?
Yes, I was sorry to say, I must also do tuberculin test in this patient as well. And also, although there is no sputum, but I might do induced sputum test as well.
I cannot remember if you have mentioned CT scan of brain.
No, I didn't tell for CT scan of the brain. I'm very sorry.
Okay. So how will you manage this case?
Actually, okay. At the beginning, I will have to do patient education and counseling. I will have to educate the patient about the diagnosis, and also I will have to form a multidisciplinary team involving the neurologist, the ophthalmologist, the nephrologist, the respiratory specialist, and also dermatologist. Okay, and then we will have to review her medication. Might have to start her on steroids. Okay, and if needed, we might have to go for other immunosuppressive agents as well. And at the same time, we might also have to involve the occupational health therapist to help her cope with the situation. And in the meantime, we might for her symptoms now. Apart from giving steroids, which she is already getting, we might have to also give her for some protection for her eyes. Okay, we might give her for some artificial tears like a methyl cellulose tears. Okay, and we might also tape her eyes to keep it closed during night time. I think these are important issues for this patient.
Okay. So I am coming for the case. You missed a little bit, like you haven't asked
Yeah.
about any night fever, night sweats, any
Yeah. Fever. Yeah. Fever, weight loss.
any neck pain, any drowsiness, any changes in the consciousness.
Yeah. Yeah.
Any nausea, vomiting, weight loss, any abdominal
Yeah.
pain, abdominal pain, signs of
Yeah. Sometimes
hypertension.
that's very bad sign. Yeah.
Otherwise, you went well and you didn't go for. And you went for the past history, and that was somewhat haphazard.
Yeah.
Uh,
Yeah.
drug, drug history, that was fine. Personal history, that was also fine. Okay.
Okay. And what should be the DDs here?
You mentioned almost everything. Sarcoidosis, Lyme disease, myasthenia gravis, myotonia dystrophica,
Yeah.
bilateral Bell's palsy, Guillain-Barré syndrome.
GBS, myotonic dystrophy, Lyme disease, and bilateral Bell's palsy. Am I right?
Yes.
Okay. Okay. So I think I excluded those. Am I right?
Yes.
Okay. So thank
But
you.
that is stroke vasculitis. You have mentioned all this.
Sorry.
Stroke, vasculitis, you have mentioned all those.
Vasculitis.
Yes, you have mentioned.
Yeah.